When I look in the mirror, I have a little pooch, and I've always had it since even when I was younger, which I can't seem to get rid of no matter how many crunches I do. With the latest fashions right now where everything hits just below the stomach, it's not a very pretty sight.
Is our patient ready? She's ready, I'm ready.
Kilja, come on in. This is Dr. Handel.
Hi, Dr. Handel. Nice to meet you.
So what's your first name?
Kilja.
That's an unusual name.
Yes, it is. It's Korean, and the first part of it means something that lives or grows in the wild, and then the last part, Ja, means long life.
You're a wild child, right?
Yeah, I like to say that.
And you're interested in finding out about what?
Liposuction.
Liposuction is an incredibly good cosmetic procedure. It's the most popular kind of cosmetic surgery. Something like 250, 300,000 people have it every year. Let me take a look at you and talk about your specific situation. So.
I've been going through a rough time this last year. Actually, my husband passed away about 9 months ago. It was unexpected. All of a sudden, he had a heart attack, and he was, a very young guy. It's a tough time. Yeah. This has just kind of given me an opportunity to get started again or to move on.
The procedure really hasn't changed that much. We've refined it and improved it over the years, but you'll get the idea. Women who lose their husband either because he dies or because they get divorced, it frequently will motivate them to have cosmetic surgery. Cosmetic surgery actually helps to lighten depression. It can really do a lot to make a person feel better about themselves, to have more self-confidence. It can really help them to kind of overcome that loss. Let me just take a quick look at you. Just want to see the areas of concern. If she's now on her own and maybe is going to consider dating people and getting back out into the social swing of things, that's something that would make a person want to feel more confident about their appearance. Do you work out?
Not as much as I need to. I just started working out some more.
Yeah. You got yourself a nice winter coat here.
Yeah, I know. Believe me, I know.
I mean, I didn't say it to hurt her feelings. I was thinking about animals like polar bears and things that, before they hibernate, put on a really thick, You do have some little waviness and irregularity of the skin. Does the inner thigh bother you?
Yes, it always bothers.
So we could do your upper and lower abdomen, your outer thigh, your inner thigh, and your knees. We can make a nice improvement in this and get it a lot flatter and get rid of a lot of this bulge and this kind of jelly belly. But you have to be realistic. Your skin tone isn't going to be perfectly tight. And
not as young as they used to be.
No, none of us are. No, none of us are.
I'm going to have liposuction on my abdomen and my inner and outer thighs. I do exercise, play tennis at least 3 times a week. I'm going to get the lipo done, and I'm going to do my stomach, which I've been wanting to get rid of for a long time. Nervous about Monday? A little bit. I'm not nervous right now, but I know I will be nervous the morning of the surgery. I'm a little nervous just being under.
You know what you're getting into. That's the main thing. Be informed.
And of course, I'm going to work out like crazy afterwards, too.
Yep. I don't know if I want to be on the court with you. New trim you. I'll be looking at you, not me.
I want a nice toned body, and of course, hopefully a flat stomach. I'm a little nervous. I wasn't nervous until this day, the morning of.
Hi, Kilja.
Hi.
Good morning. You ready for your surgery?
Sure am. I think anybody would be nervous, actually, just before going into some type of surgery.
Hi, good morning.
Good morning.
This is Dr. Cordray.
Hello, nice to meet you.
Kilja. I'm going to do is have you swing around here. You can actually just lift this up.
Right.
Are you comfortable like that?
Yeah, sure.
Okay. I'm going to try to make your, give a little more of that hourglass look by getting into the flank area here. But this makes a nice difference when we do this. You can just see as I squeeze her with it. That's going to be very nice. That's a good area. It works well. And then we're going to do your inner thighs and your knees. We're going to take good care of it and give you a nice result.
My stomach is calm. I feel calm.
I think in Kilja's case, she lost her husband recently, and that may be something that kind of makes you stop and think about life and think about what you want. And maybe that was one of the precipitating things that led her to have her surgery at this time.
To walk through the gauntlet here. Yeah.
We're going to do quite a bit of lipo. She's got a very thick layer of fat. I want to get around to her back to kind of give her that hourglass sort of look. Kilja is an excellent candidate for liposuction. She really does have some discrete localized areas of excessive subcutaneous fat, but she's not really overweight. I think I hurt her feelings. At one of the pre-op visits, I said, well, you've developed quite a winter coat. Well, is that rude?
A little bit.
You think so?
Yeah,
I didn't mean it that way.
I would be horribly offended.
That's not nice?
Pick your most sensitive area and imagine someone taking that apart.
You have a little ding-dong.
I can't say anything.
Listen, you've been in practice for 30 years.
I'm just thinking about how many people I must have alienated in that period of time without knowing it. If I have offended anybody, I'd like to take this opportunity to apologize to them right now. When somebody comes in for liposuction...
I know, that's true. They all know in their brain that they're coming into a doctor to have
Yeah, I mean, this isn't a girl I met at a party who... Excuse me, ma'am, but you've developed quite a winter coat. When the plastic surgeon is doing liposuction, the most important thing isn't really how much you remove, it's how much you leave behind. You want to make sure that you leave enough subcutaneous fat so that the patient has normal contours, doesn't have dimpling, irregularity, or any asymmetry. Those are really the risks of liposuction. Suction off. This flap here actually feels very thin. I don't want to go any thinner than this anywhere, but with this little pinch test, you can kind of roll your way across and see. We actually pinch the skin and see how thick the layer of fat is and determine how much fat was left under the skin. This is thicker, right in here. Power on. Sucking fat out of a patient, you can actually see a change in the contour of the patient's body that you've wrought by the labor of your hand. It's really dramatic and very gratifying. That's a big improvement, they'll feel that. It's good quality fat. Look at that stuff. Oh, that's beautiful. Well, I think we're just about there for their abdomen. Now we're going to do the inner thigh. Liposuction involves some physical effort. Oh, boy. I think there's a certain rhythmic, sensuous feel. You're really in contact with the patient's body in a way that you aren't with a lot of other surgical procedures. She looks very symmetrical. I think, Dr. Feldman, does she look symmetrical to you? I mean, the whole contour of her body is completely changed. Her outer thighs don't have that bulge, a saddlebag deformity. I'm very happy with it. Kilja's liposuction surgery went very well. We were able to remove a very large volume of fat. We took out a total of about 3.6 liters to 5 or 6 pounds of fat. And when that comes off of just the right areas, it makes an enormous difference. It's a lot of fat. That's a nice amount to get off in one day. That would take many months of dieting and exercising. She's shed her winter coat, and she's getting ready for the summer now. She's going to be able to reveal her body and be proud of it. Kilja just came in for her first post-operative visit. She had liposuction of her abdomen, her flank area, her hips, her knees. Good morning. Wow, look how pretty you look.
Oh, I gotta work.
Oh, is that it? I thought you got all prettied up for me.
Oh, I'll
your boss. Kilja's liposuction surgery went very well. We were able to remove a very large volume of fat. All right, well, how are you feeling?
Much better.
Good.
Yeah.
You look like you're feeling a lot better.
Yeah, day by day.
It is a slow process.
Yeah, I still have swelling.
Oh yeah, there is. But you know what we do is pretty traumatic. Sticking a metal rod in there and jamming it in and out through your subcutaneous tissues causes a lot of swelling. Your body actually makes fluid that kind of puffs up the area. Look, it actually takes 2 to 3 months for all the swelling to go out. And I'd like to see you again in 2 or 3 weeks just to kind of get
good. Right now, my stomach is very different. It's a little bit flatter to me, and my clothes are fitting much better. I now have a flat stomach, which is definitely what I wanted. I don't have that pooch that I've been talking about for so long. It's actually gone, so I'm very happy about that. I feel good. I mean, I don't feel sore. I always like to go to the beach, but I always was self-conscious because you have to wear a lot more revealing clothing. So now going to the beach, I have no self-conscious whatsoever. I can wear the clothes that I want to wear. I feel a lot more confident right now. I'm definitely glad I did do it.
You look great.
Woo! Nice shot, Ashley.
Sorry.
My husband passed away last October, so it's only been 9 months. Losing my husband this last year has been very difficult for me. The surgery has made me think about starting over. It's just something to take my mind off of the grieving and again to take that next step to go forward.